We all know milk is good for our bones and a great source of calcium, right? But what if I told you that pairing milk with certain medications can actually block your body from absorbing the medicine properly? In this article, we'll break down why this happens, which drugs are affected, and what to do instead, especially for older adults who often take these medications daily. Why milk isn't always a good match for medication. Let's start with the science. Milk contains high levels of calcium, magnesium, and casein protein. While these are usually beneficial, they can interact negatively with specific medications. The calcium in milk binds to certain drug molecules in your stomach, forming compounds that your body can't absorb. So instead of the medicine going into your bloodstream where it's needed, it passes right through you, wasted. This isn't just about effectiveness. For people relying on these meds for infections, osteoporosis, or thyroid problems, missing your dose without realizing it can be dangerous. Common medications that shouldn't be taken with milk. Let's look at the biggest culprits. Medications that lose their power when taken with milk or dairy. 1. Antibiotics, tetracyclines, and fluoroquinolones. Examples: doxycycline, ciprofloxacin, levofloxacin. These are commonly prescribed for bacterial infections like pneumonia, sinusitis, and urinary tract infections. Calcium and magnesium in milk bind to these antibiotics, making them ineffective. Real-life example: a senior woman taking doxycycline for a chest infection might still feel sick after a full course. Not because the drug doesn't work, but because she was washing it down with a glass of milk every morning. 2. Thyroid medication, levothyroxine. Used for treating hypothyroidism, levothyroxine is very sensitive to what you eat or drink. Calcium from milk can drastically reduce absorption, which may lead to symptoms like fatigue, weight gain, and depression, coming back even if you're taking the medication consistently. Tip: take levothyroxine on an empty stomach with plain water, and wait at least 30-60 minutes before having breakfast or any dairy. 3. Bisphosphonates, used for osteoporosis. Examples: alendronate, Fosamax, risdronate. These medications help keep bones strong, especially for postmenopausal women and seniors. But taking them with milk defeats the purpose. They'll barely get absorbed. In fact, these should be taken with water only, first thing in the morning, sitting upright, and with no food or drink for at least 30 minutes after. 4. Certain iron supplements. Iron is crucial for people with anemia, but calcium in milk blocks iron absorption too. So if you're taking an iron pill in the morning, along with your coffee and cream, or cereal and milk routine, you're sabotaging your treatment. Better approach: take iron supplements with orange juice or vitamin C-rich foods to boost absorption. Don't be fooled. Yogurt, cheese, and calcium-fortified foods. Count 2, it's not just milk in your glass, that's the issue. Yogurt, cheese, protein shakes with calcium, and even some breakfast cereals can all interfere. Even antacids like Tums contain calcium carbonate, and they can cause the same interaction. When can you take dairy safely? Good news, you don't have to cut out dairy altogether. The key is timing. Here's a safe guideline. Take the medication on an empty stomach with water. Wait at least 1 to 2 hours before or after eating any dairy products. This buffer gives your body time to fully absorb the medication before calcium steps in. Important advice for seniors and caregivers. Older adults are more likely to be on multiple medications, including those that interact with milk. It's crucial for caregivers and patients alike to read the medication guides, ask the pharmacist, and time meals properly. Taking a few extra moments to separate milk from medicine could mean the difference between a drug working or failing. Final thoughts. Milk is a nutritious drink, but it's not always a friendly companion to your medication. Knowing when to take your meds and what to avoid with them is just as important as remembering to take them at all. If you're unsure, always consult your doctor or pharmacist for guidance tailored to your specific treatment plan. Stay safe, stay informed, and take your health into your own hands.